Hello, my name is Grace Bertin. I am a sophomore at Westchester University, and this is my final individual presentation based on COVID-19 and how it relates to public and community health for HEA242 Public and Community Health with Professor Baysinger. COVID-19, or the novel coronavirus, is a respiratory virus whose symptoms include, but are not limited to, shortness of breath, cough, and a fever. This virus was previously unknown and was discovered in Wuhan, China in December 2019. Since its discovery, this disease has spread across the globe, and as a result of the rapid spread of the virus, countless countries were and are currently in lockdown as an attempt to slow the spread and decrease the exponential growth of the spread of the disease. All countries are responding to the virus in different ways, and almost everyone, everywhere, is required to wear a face covering in public. And the United States has experienced the most cases and deaths from the illness since March. Since its discovery, healthcare professionals and scientists are all conducting research to learn more about this disease and how to treat and prevent this highly communicable virus. The problem at hand with this virus is that the whole world has been impacted by its spread, as it is a global pandemic. So as a result of the first wave, many countries had their schools, bars and restaurants, and any non-essential workplaces shut down in-person interactions and switch to online formats. Because this virus is spread through respiratory droplets, like from a sneeze or a cough, it can spread very easily through all different types of communities. And since this disease was previously undiscovered, scientists and medical professionals are working very hard and diligently to understand the epidemiology behind this virus and its community spread, as well as how to further prevent it from getting a second wave. Because we're still learning new things about it, there is consistently new information coming out, which can cause some confusion among communities on different mandates and health and safety requirements. The United States government has also not given as much guidance on the virus as they could be, which is causing further problems in this pandemic regarding community spread and how to handle this virus as a country. In order to prevent the disease, there have been mandates that individuals must wear face coverings while out in public, and the face coverings must cover both their mouth and nose at all times. And public officials are also suggesting that people remain 6 feet apart from anyone who is not in their immediate household. So these preventative measures have helped to slow the spread of the virus. And scientists have been working on developing a COVID-19 vaccine since the beginning of the pandemic, and as of November 2020, there are currently at least 3 working vaccines in the world. New York Times notes, the drug maker AstraZeneca announced on Monday that an early analysis of some of its late-stage clinical trials conducted in the United Kingdom and Brazil showed that its coronavirus vaccine was 70.4% effective in preventing COVID-19. So I believe that this would be a form of primary prevention because once the vaccine is fully effective and able to be mass-produced, people will be able to avoid contracting and spreading the virus to others. Until a majority of people are able to be vaccinated, we will have to continue our testing and contact tracing as a form of secondary prevention to ensure that individuals are quarantining when necessary in order to prevent further spread of the disease. Social media has also played a major part in raising awareness about the virus and communicating ways to help protect oneself and others from contracting COVID-19. The Center for Disease Control, or CDC, uses graphics throughout the coronavirus page on their website, which complements the informational text provided about the virus. Various websites and platforms also emphasize particular phrases, such as putting distance between oneself and other people, and keeping distance from others, especially those who are at a higher risk for getting very sick. Public officials have also been using social media platforms such as Twitter and Instagram to emphasize the importance of staying at home. For example, the Pennsylvania Health Department Twitter notes, "Social distance works and closures are saving lives." They not only use regular website formats to relay the information to the general public, but are also using social media as a way to effectively communicate short messages to the public. Shown on this slide are just two of many graphics featured on the Center for Disease Control CDC website regarding COVID-19 information. These graphics all around the website page are included to help individuals better understand how to prevent spreading the disease in a more visually appealing manner. The graphic on the left specifically is one that shows how to properly choose a mask, as well as properly wear it. This graphic explains the effectiveness of having a mask with more layers, which will help prevent the spread of the respiratory droplets when talking, coughing, or sneezing. The graphic on the right tells the proper distance to be socially distant when around others in public, and reminds people to wear masks at any time around other individuals who are not in one's immediate household. These graphics and images have been designed to help individuals better understand the significance of properly wearing face masks and remaining socially distant with others when out in public, which will in turn help prevent the spread of COVID-19. For the discussion questions, I have 3 listed. You can choose to pick whichever one you want in the discussion replies. So the questions are, in your opinion, has the United States been doing enough testing for the virus? 2, what has the United States failed to do that other countries were able to do in regards to preventing the spread of the disease? And 3, do you think a lockdown in the United States would be beneficial for the country, or would it hinder, and for what reasons? Thank you for listening to my presentation on COVID-19 as a community health issue and my possible solutions and prevention for further spread of the disease.